Now, a lot of dance teachers and a lot of dancers have pain in their plantar fascia, and I get asked all the time, how do you treat plantar fasciitis? And the first thing I say is, unfortunately, it's not usually plantar fasciitis. It's plantar fasciosis or a tendinopathy deep in the foot. So the plantar aponeurosis sits along the bottom of the foot, and part of its role is in that buoyancy and spring of the foot. Unfortunately, what happens in a lot of people, if you're carrying a few extra kilos and the foot is sitting in a sustained lengthened position, if the foot doesn't have control of pronation and it's sitting in an overly pronated position, if the foot is really rigid through the midfoot and it's not moving nicely when you're walking, these tissues are held in a lengthened position on a stretch, and their blood supply isn't that great. So all of our tissues need nourishment and hydration. If it's sitting in a long extended position all the time, the tissues start to degenerate. So the tissues are in a lengthened position with not much blood flow. Unfortunately, what a lot of people used to do in the past to treat it was stretch it, ice it, and massage it. And in my view, this is the complete opposite of how we need to treat this issue. If we stretch it, we're further stretching tissues that are already stretched. If we're icing it, we're further compromising the blood flow to tissues that really need blood flow. And if we're massaging it, we're rubbing on degenerated tissue, which may make it worse. Instead, if we think of reassembling the foot, so using the cross tape, dynamic tape, to reassemble it in position. If we train the control from the hip so that the foot can deform and spring back and deform and spring back, we're going to be nourishing and hydrating those tissues. If we use contrast bathing instead of icing, so hot, cold, we're going to drive new healthy blood and healthy healing fluids into that area rather than restricting them. And if we focus on releasing structures further up, so anything along the superficial backline may feed down into this fascia, we will get an indirect release without damaging all the tissues that are already a little bit compromised. So if you have issues with the sole of the foot, I really encourage you to look at all of those factors when we assess the foot and make sure we're removing those rather than just stretching, icing, and rubbing out on the bottom of the foot.